Do collateral vessels ever die? And if so, under what circumstances, or do they ever, go back? Because patients are really worried and about over and over again that, hey, I'm walking, walking, walking. I'm 80 years old. I'm a fall risk, of course, at that age, and a hip break risk. What happens if I'm walking? I grow these collateral vessels, and suddenly my knee gives out, my hip gives out. I can't walk as much. I'm in that I'm sedentary for a while. Are those collateral vessels going to die? And I'm going to end up where I could have had a procedure to open up a short focal lesion. Now it's this long calcified occlusion that is much tougher to get through. And I'm more at risk of losing my leg. That's kind
Yeah,
of the thought process. What are your
yeah,
thoughts?
yeah. The short answer is no, the collaterals wouldn't die back or wouldn't die off and if they're not used. But I think to I think in the same way that um so your collateral vessels are same kind of blood vessels as your main vessels, so they are at risk of clogging up just in the same way as your main vessels are. Um, and so it is a worry and a challenge if there are other reasons why you're not able to keep doing that walking or that exercise. And that's why it's so important to try and address all these other factors or potential barriers to walking so that you can get out or moving to kind of keep using your legs and building this network. And it's such a useful question. It's actually something that's affecting my dad at the moment. So my dad has peripheral arterial disease, and he's also got an arthritic hip. So he's been on the waiting list for surgery for a hip replacement. And this is the one thing I've been talking to him about, and the one thing I've been trying to encourage him to talk to his doctors about is because he's in a prolonged wait for a hip replacement. It's taken a long time to get to the front of the queue. And I keep reminding him to go back and remind the doctors how important it is for him compared to, say, someone without P.A.D, that he must, needs this done as quickly as possible because the pain he has in his hip because of arthritis is stopping him from walking. And the longer he's slowing down and not walking, the more risk he is of everything else. And so it's just I understand that worry, that fear, that experience.